Common thing that patients want to know is what is the advantage of having it under local anaesthetic. Essentially, there's two folds. Firstly, it depends on patient's general health. Some patients have an underlying heart condition or lung condition and they're just not suitable to have a general anaesthetic, because with general anaesthetic you put under, and that means that your heart and lungs under the anaesthetic, and that may cause more harm to a patient. So local anaesthetic avoids that, and it means that it just works locally and it doesn't affect their heart or general health in any way. The second thing that's quite important about local anaesthetic is the fact that by having a local anaesthetic, it means that you can have a walk-in, walk-out procedure. With a general anaesthetic, you have to naturally stay over in the hospital to make sure the effects of the anaesthetic's worn off, and you have somebody caring for you, regularly monitoring your heart and blood pressure to see how you're recovering. With local anaesthetic, none of that is required, so the patient can come in, have the procedure, afterwards have a seat, have a cup of tea and biscuits, we go through the aftercare, and when they're fine to go, they can leave. It also means that with local anaesthetic, you don't have any restrictions with driving the next day, with taking a flight the next day, because the general anaesthetic is what affects those. And typically with the general anaesthetic, you may not be allowed to fly for about 6 to 8 weeks. Whereas with local anaesthetic, that is not a concern. Is no different to having a dental procedure. You can do everything else the following day.